Good morning, good afternoon, and good evening all. So once again, a very warm welcome on behalf of MYT. We're very happy to support you with day 2 of the second annual Health Campaign Effectiveness Coalition meeting for our closing plenary on the promise of collaborative action, followed by a panel discussion with perspectives from the HCE Leadership Team. We'd like to open with a few housekeeping notes before handing over to Kris and Leah. So we're delighted to offer today's session in English, French and Spanish. You will see on the Zoom menu bar the interpretation button. Please select your language now. And once again, for the benefit of our French and Spanish speakers who've already joined us. Pour écouter la version française, il faut cliquer sur Interprétation dans les options de la réunion de Zoom et sélectionner le canal français. Y para escuchar la versión española, se puede hacer clic en Interpretación en las opciones de la reunión de Zoom y seleccionar el canal español. So thank you to our interpreters for your support today. Please be aware that the sessions will be recorded and you will be able to view the recordings post-event via the Health Campaign Effectiveness Coalition website. And once again, we'd like to encourage interaction. So please use social media channels to promote and engage a wide audience with this event by tagging @HCE Coalition and using the hashtag collaborative action. So for today's session, Leah and Kris will be asking you for your reflections and feedback via the Zoom chat feature. And also we'll be using several Zoom polls. So please do join the conversation. And also for our panel discussion, please add your questions to the Zoom Q&A, which can be found at the bottom of the Zoom screen. And you'll be able to see all the questions posted, upvote and add additional comments, as well as ask questions in English, French and Spanish when the interpretation is available. And if you're not able to hear a question in another language, please ensure you've selected your interpretation booth. Okay, so we'll aim to answer as many questions as possible during the session. And finally, the MYT team are here to help you with any technical difficulties. Please use the chat facility on Zoom or email the team at events@myt.uk.com. So I'm now delighted to hand over to Kris and Leah to welcome you to the session. Thank you.
Thank you, Debbie, and welcome back. I'm so excited to be back with you again today and really impressed with the energy and the great ideas that I've heard in all the breakout sessions. And I first want to give a show of appreciation to all of our presenters and our moderators. Also, please give us a thumbs up if you've heard or learned something new in the sessions so far. If you've got something you would like to share, one thing that maybe sparked your interest during the meeting, please go ahead and share a word or two in the chat. It's really great to hear some of these ideas that have come out of so many great breakout sessions over the past day and a half. In this session, Leah and I would like to share a few highlights of what we've heard so far in the meeting, and then ask you to provide us with some real quick feedback on priorities for the coming year. It's nearly impossible to summarize all the good ideas and discussion into one slide, even if I make the font really small. So I know I will have missed at least a dozen key points. However, if there's a few, I think there's a few common themes that really struck me that I heard repeated multiple times from different presenters and participants, and I would like to share them with you. The first one that really caught my eye was that we've got such promise with integrated campaigns. Lots of great promising practices, great ideas, a lot of work that's being done in the field that's just quite amazing and very innovative. But we also heard the need for, first point, please. The need for the advocacy and guidance on what works. So there's a potential for this coalition to really move forward with some of that advocacy and think about what do we need in terms of collective guidance. And we'll talk about that in just a minute in one of the polls. The second thing, as I've heard some great exciting advances in digital and geospatial tools. Technology has advanced, we know, just exponentially over the past decade or so. And so that's had a great impact on the way that we can do campaigns. We've heard about the ability to have much better improved data quality on our populations and our denominators. We've got a lot of opportunities with technology to have better accountability with real-time monitoring and efficiencies in service delivery. We've also heard, I think that the ways that these improvements in technologies are going also have benefits way beyond just campaigns, but really have an opportunity to strengthen the broader health system. Third, very, very importantly, we heard that we must have much, much broader engagement of communities. It's absolutely necessary to engage them actively in the campaign planning, and especially during the micro-planning phase. What I heard come out of several sessions is that if we're going to do integrated campaigns, we must have a targeted, people-centered approach that's very responsive to the local needs and the context. And that means involving communities at the beginning. Fourth, we heard that there's a real opportunity to strengthen the health system if we are going to think about integrating or transitioning campaign services. It's not enough just to say, okay, we're done with campaigns. We need to put all of our energy into primary healthcare services. We know that there's a balance and there's a long transition process. And we need to really think about what does it mean to strengthen the entire health system as we're starting with our integration approaches as well as those transitions. And this is something that resonated multiple times in some of the sessions where we have countries that are really working on these transition issues. Really importantly was the idea around equity, and that the need for equity to be factored into all of our work, from the planning phase, also to identifying some equity measures for outcomes, and especially when we think about equity issues as we transition in and out of campaigns and routine services. So I think we all agree, it's been in many of our discussions from the very beginning, that equity is something that this coalition can play a really significant role in addressing. Finally, we heard that there are some barriers though, and these are barriers that cut across a lot of our work when we're thinking about integrating campaigns in terms of the way that campaigns have been historically financed. We know we absolutely need to overcome this barrier if we're going to move forward. So what does that mean for the coalition? Is there an opportunity for us as a collective group to really bring together the different decision makers around campaign financing and funding and think about how to overcome these barriers? So this is all I could fit on the slide. There was a lot more ideas that I think resonated. I'd love to hear yours in the chat that really spoke to you. These are some that popped up in my mind. And over the next few weeks, the program office will be working with our moderators to summarize all of their notes, and we'll share them back with you, as well as all these session recordings on our campaigneffectiveness.org website. So if you remember in my opening remarks, I asked you to think about 3 questions. What successful collaboration looks like to you? What would be different or really change as a result if we had that collaboration across our different programs and campaigns? And specifically, what should the Campaign Effectiveness Coalition focus on in the coming year? We know the coalition is and can play many, many roles, but we also need to focus our efforts next year on the most important actions. In many of the sessions, we asked your input on what the coalition should do, and we heard some great ideas. Now we're going to move into 3 very quick Zoom polls for you to take. Leah will share those with you in just a minute to think a little bit more concretely about the coalition's roles in general, as well as some ideas that we have to move forward with some practice guidance. So tomorrow, watch your inbox. You will receive an email with a link to a survey, because we know we only have time today for a few short questions, but we'd love, in order to build this collective action plan with you for the coalition, we'll get more insights and much deeper insights from you in a survey. So watch your emails, we'll send the survey to you, and you'll have a lot more opportunity to provide feedback on the priorities and describe your ideas. So your input is really essential. It is you, the members, who set the priorities for this coalition. So Leah, let's get started with a few polls.
Yeah, great. Thanks, Kris. So we acknowledge that equity is a theme that cuts across all programs. We also recognize collectively that campaign integration from full to partial shows promise. We have a working assumption that campaigns and their components, when integrated, improve equity. This is central to programming. There were lots of great ideas about how to get to that point. And there's a role that the coalition can play here. From your perspective, what is that role? So I'm going to ask MYT to pull up the first poll. Get your fingers ready and your mouse is ready. From your perspective, what among these different roles for the coalition should we focus the majority of our efforts on in the next year? Please choose two options from the list below, and I'll read those off. 1, we could curate and synthesize tools that identify the populations at risk across health domains for campaigns. We can replicate promising practices across campaigns and geographies. We can explore community factors associated in reaching the never treated zero-dose populations. We can develop and test equity outcome measures at the country level. And we can advocate for policies that enable equitable campaign delivery that address financing for campaign integration. But if you could only choose two, which two would you choose? So I see the results coming in. For those who already put your or made your selection, if you feel that these options that I've presented are limited, feel free to put additional and even better thoughts and ideas into the chat. So I'm going to give everyone about another 30 seconds to answer the poll. Okay, I see it slowing down just a bit. Maybe just 5 more seconds. It's so great. I have a little timer here I can see, so that's nice. Excellent. Okay. Let's see. I see a couple more. All right. Are we showing the poll now? Can you guys see it? Thumbs up if you can see it. All right. The results. So the results are in. All right. So curating and synthesizing tools is, wow, I see some, a few that are kind of common in their response of interest in terms of developing and testing equity outcome measures and exploring community factors. So there's a bit of a split there. So that's nice. And also between curating and synthesizing tools and replicating promising practices. So what the program office is going to do is really dive in and ask you about opening up some of these, or really peeling back the onion, if you will, and some of these responses in action planning activity that we're going to send you tomorrow. So let's go ahead and stop sharing this poll, and let's go on to the next one. But just know we as a coalition, we can go into this a bit more. So there has been a lot of interest for this coalition to develop tools and guidance around campaign integration. The Campaign Integration Working Group has taken the first step by developing guidance to support decision-making for integrated campaigns. Linksbridge is currently working on an interactive online version of this tool to further inform the decision-making process at the country level. We know that there is interest in expanding the integration toolkit, but where should we go next? So I'll read off some of the responses. Thanks for going ahead and adding your thoughts there. Which of these components do you think should be prioritized in an expanded integration toolkit? Pick which two we should start on immediately. Just if you could choose two of this list, and I'll just read them off. Advocacy and engaging stakeholders, planning at the macro level and more strategic planning, micro planning, procurement, logistics and supply chain, communication and community engagement, implementation in terms of integrated campaign delivery, monitoring and evaluation in terms of including data collection and reporting, and finally financing, including cost sharing recommendations. So I'm just going to pause right there, allow you a moment to choose which component you feel this coalition should prioritize in expanding the campaign integration toolkit. Again, if you have even better ideas, please put those into the chat. I'm just going to give it about 30 more or maybe 15 more seconds. And thank you all for your responses. I see over half of us on this call have responded. So let's keep the responses going in the next 10 seconds here. And again, we'll dive into these components by way of an action planning exercise. This conversation does not stop today. It is continuous. So stay engaged and you'll see something drop in your inbox tomorrow. Okay. All right. Let's go ahead and show the results. Thanks, Russell. All right. So I see a lot of some equal interest almost across advocacy and engaging stakeholders in planning, macro level planning, and also communication and community engagement. Again, let me scroll up. And we have 45% is interested in financing. So thank you for that. We'll dive into these tomorrow with you. Okay. So let me just go to my notes here. So this next question is about transitioning campaigns into primary healthcare systems. We know that primary healthcare systems are at varying degrees of readiness for transitioning campaigns into ongoing health services. The coalition has 6 different implementation research projects exploring this challenge right now. From your perspective, what is most important for the coalition to focus on as it relates to transitioning campaigns into primary healthcare systems? And let me just go ahead and read these responses or choices or options to you. One role we could play as a coalition is in developing a readiness assessment of the health system to transition campaign services to primary healthcare systems. We could involve ourselves in advocacy and communication around transitioning campaign services to primary healthcare systems. Another option, synthesize evidence and promising practices as it relates to the transition process. And lastly, is promote digitalization of campaign components into the health system infrastructure. So here are 4 options, 4 different roles we could take. I know we want to do it all, but within 12 months, the next 12 months, what should the priority be? I see a lot of energy in one area. I'm not going to release the results yet. I want to give you a chance to respond. This is really great. Again, I'll say it again. There's 4 options here. But if you have even better options, a better thought, or another idea, please drop it in the chat. I'm just going to keep it open for another 20. Again, more than 60 of us have responded. 60% of us have responded. Can we get it to 80? Can we get that to 80? All right, we're inching closer to 80%. Not quite there yet, but I do thank you all for providing your thoughts already. Okay, rest, let's go ahead and show the results. All right, there's a lot of energy around synthesizing evidence and promising practices, as you can see. So what we will do is ask you a bit more about synthesizing evidence and promising practices, perhaps as it relates to the transition process. So You'll get some information from us on that. And again, ideas that we didn't mention, drop them in the chat. And Kris, I now turn it over to you. Thank you, everyone.
Thanks, Leah, and thanks everyone who provided some, quick input. And again, these are just 3 quick Zoom polls. I think Leah mentioned that we couldn't ask everything today, but we wanted to get you warmed up because, as we said, developing the action plan for 2022 for this coalition is a really, really important task. It involves all of you. It involves all of our leadership team, our scientific and technical advisory committee, our work groups, all of our members. And so your voice is really, really important. This coalition is owned by you, and we've so far really appreciated the input that you've given us. So like I said, the intent was just to get some quick impressions. What comes up right after in just a minute is our ideas from our leadership team. So you'll hear from several of our leadership team members what their thoughts about opportunities for the coalition and where they see some of the priorities. In the next few weeks, you'll, like we said, you'll receive a survey from us just hopefully tomorrow in your inbox. We'll have a leadership team meeting in the next month. And then we'll also be working with the Bill and Melinda Gates Foundation to have their input as we coalesce all these ideas into next year's plan. We'll be able to share that with you in December. And then there's a real opportunity for us to launch some new work groups, task teams, different efforts. We'd love to hear from you again in the chat, in the survey we're sending. What is meaningful for you? We've tried a lot of different things over this past year. We've had some test and learn seminars and webinars. We've been able to launch our implementation research awards. We put out a series of different studies and findings. And then here we are today. So there's a lot of energy that's been moving forward over the past year. But as Leah has mentioned, it's time for us to focus in on a few critical actions that will really make a difference for us in the coming year. So with that in mind, this is a perfect transition for our final panel discussion with members of our leadership team. I look forward to hearing their insights and perspectives on the priorities. To moderate this session, I'd like to introduce Dr. Patrick O'Carroll. Dr. O'Carroll is a member of the executive team at the Task Force for Global Health and the head of our health systems strengthening sector, of which this program is a part of. He has a distinguished career in public health and previously worked as the regional health advisor for the U.S. Department of Health and Human Services and at the Centers for Disease Control and Prevention. Patrick has been an early visionary and designer of the HCE program at the task force, and he continues to provide strategic guidance and a lot of great, real creative thinking to our program on a daily basis. Please welcome Dr. O'Carroll. Thank you.
Thank you very much, Kris. That was kind of you. Kris has to say nice things about me because technically she reports to me, but I think sometimes I report to Kris. I really appreciate your leadership, Kris, and this has been a great meeting, so thank you very much. Greetings to everyone, and welcome to our closing plenary panel, in which members of the leadership team of our Health Campaign Effectiveness Coalition will share their own insights about ways to strengthen collaboration among campaigns and with country health systems, as well as opportunities to improve health impacts by changing the ways in which campaigns are financed. Importantly, the panelists will also share their ideas for specific actions that this coalition should take during the coming year, as Kris indicated. We're very fortunate to have 5 distinguished members of our leadership team on our panel today. Let me first introduce all of our panelists, and then we'll begin. To maximize time for all of you to engage with the panelists at the end during the Q&A period, I'll keep my introductions brief. But please note that the full biographies of our esteemed panelists are available on the meeting platform. Our first panelist will be Dr. Marcos Espinal, Director of the Department of Communicable Diseases and Environmental Determinants of Health at the Pan American Health Organization, or PAHO. Before joining PAHO in 2010, Marcos worked in the Ministry of Health of the Dominican Republic and the National Center for Research on Maternal and Child Health, at the New York City Public Health Department, and for 13 years at the World Health Organization, or WHO, in Geneva. Our second panelist will be Dr. Christopher Gregory, Senior Advisor and Team Lead of Accelerated Immunization Initiatives at Unicef Program Division Headquarters in New York. In this role, Kris manages UNICEF's activities for global disease control initiatives for measles, rubella, meningitis, yellow fever, cholera, and tetanus, as well as immunization needs and humanitarian response. Prior to joining UNICEF, Kris had been with the US CDC since 2008, most recently as chief of the Arboviral Diseases Branch in the Division of Vector-Borne Diseases. We'll then hear from our third panelist, Mr. Chris Wolfe, Deputy Director of Health Funds and Partnerships within the Global Delivery Programs at the Bill and Melinda Gates Foundation. At the Gates Foundation, Kris leads the team there that is focused on strengthening country partnerships. Prior to joining the foundation in 2014, Kris worked for WHO for nearly 15 years. His various roles there included managing the team providing support to countries responding to polio outbreaks and overseeing one of WHO's largest global disease surveillance and data networks. Our fourth panelist will be Ms. Anarata Gupta, Deputy Chief Executive Officer at GAVI, the Vaccine Alliance. Anarata joined GAVI in 2015, where she led efforts to put equity and gender at the center of GAVI's programmatic planning and worked to improve country ownership and leadership of GAVI-supported programs. Prior to joining GAVI, Anarata served as Mission Director of the National Health Mission of India, where she ran what I believe to be the largest public health program in the world. Our final closing panelist and the chair of our coalition leadership team will be Dr. Ahmed Joffrey, the Director of Polio Eradication at the WHO Eastern Mediterranean region. Hamid leads polio eradication efforts there in close collaboration with other partners in the Global Polio Eradication Initiative in 22 regional member states that include Afghanistan and Pakistan, which of course are the two remaining polio endemic countries. And so with these brief introductions, first, let me remind you participants to put their questions as they occur to you all into the Q&A box, and we'll address as many questions as time allows after all the presenters have spoken. And now, let me turn to Dr. Marcos Espinal of PAHO with my first question. Marcos, turn on your camera there, and from your perspective, let me ask you, what can the Health Campaign Effectiveness Coalition do to help foster the kind of collaborative planning that really helps countries be more effective in reaching their goals and engaging with their communities?
Thank you, Patrick. Thanks for the invitation and a pleasure to be here. You know, I enjoyed the polls that you guys showed, because some of the issues I wanted to mention were in the polls, and I think it's a great idea to collect the views of everyone. I think I'm going to, you asked me to be about 5 to 7 minutes, so I'm going to try to respect that. I think the coalition can do several things to make sure we are effective and we are successful. At the end of the day, the interest of the coalition is to get rid of some of these diseases that are affecting many of our people in endemic countries and in countries that are close to elimination of some of these diseases. So first thing I would say is a non-negotiable principle that the coalition should embrace is alignment and support to the countries. The coalition don't eliminate, the coalition don't control diseases. It's the countries that control diseases and eliminate diseases and boost educational campaigns and boost health campaigns, deworming, mass drug administration, and so on. So at the end of the day, we need to make sure we are aligned with the local context. And for me, that's a non-negotiable principle. I remember several years ago when I was at WHO, I went to a meeting in Rome to discuss the MDGs, how to reach the MDGs. And I remember a minister from an African country saying, and that resonated on me, saying, my job is not being a minister, it's just to sign questionnaires and forms and donor reports and NGOs reports. And that doesn't allow me to do my job very well, because I'm always have to listen to the agendas on many of these institutions. So this is why the non-negotiable principle of alignment and supporting the countries with dialogue. So respecting, what their views are, because at the end of the day, it's their own people that are suffering of these diseases. For me, the coalition in this principle, it needs to use flexibility, needs to use consensus building, and making sure we are empowering our partners in the countries, being an NGO, being a government, or so, whatever it is. The second thing I think the coalition could do is, the coalition is in a great position to boost advocacy and communication. And maybe I would say advocacy to another level in terms of promoting integration into health campaigns. If we're going to do immunization like PAHO, when the annual week, immunization week, we did deworming, taking advantage of that platform of the immunization and discuss it with the school. So I think advocacy, it's an opportunity here, because I think advocacy will bring the commitment of the leaders, will bring the momentum back, and will sustain that momentum for not only the coalitions, the health campaigns to be successful, but also to get into the transition to primary healthcare. And one of the ideas on advocacy is, there are several: op-ed, journal-specific special issues, taking advantage of important events that already are running annually. We don't have only to be ourselves, but to make sure we have sessions in those meetings, getting to know our leaders in the countries and take advantage of that by bringing them into the table also. I think it is important also to make sure we educate others. I mean, we cannot go with one problem that we always see in many settings is people coming to countries with their own agendas. No, it's the agenda of the country. So, and advocacy is critical if we embrace that, because at the end of the day, if our leaders nationally don't embrace us, then they go the other way. And what I think dialogue is very important, and advocating, promoting the integration by using the value added of many of these health platforms, I think is great. The third thing I would say is building partnership, public-private sector partnerships, not only at internationally, at local level. It is important that at local level, we make sure the government partners also with NGOs, with societies, with local, the communities. The most important thing, the community. If we are not able to engage and empower the community and the civil society, then I think, let me put it this way, our job will be more successful than that. And finally, I wanted to raise the issue of synthesizing best practice. This is critical. I was thinking on it, especially, and yesterday I joined the sessions, and I listened to so many good presentations and experiences from endemic countries and pros and cons. A compendium of best practices to be showcased, to be promoted. Because we've been talking about integration for many years, and sometimes it's confused with those health sector reform of the World Bank that destroy many programs in Africa and in other countries. It's not about that. It's taking advantage of the platforms. It's taking advantage of the best things, the priority programs bring on board and putting them together and trying to find solutions for the cons, the problem with supply, logistics. And I heard a lot of experience yesterday, and I think synthesizing best practices is key for the coalition to succeed, because that will be a service to the countries, to the people in the field, and to entities that are really doing the job for the people of affected by these diseases, and also in prevention. I pause here because I think my 7 minutes are almost approaching, but happy to answer any other question, Patrick. Thank you.
Thank you very much, Marcos. That was fascinating. And as you know from attending some of the conference, many of the themes you touched on are in fact have been front and center in the minds of many of our participants. The country first aspect, certainly. I really appreciate your very concrete ideas for what form our advocacy could take, because I think it's important to know specifically what we can do. I'd be interested if I could follow up one quickly with you. If we do a good job as a coalition of putting the countries first, how would we measure success? How would we see the results of us putting the countries first? What would we see us doing that was evidence of that?
Well, I think it's important. There are always plenty of indicators out there that people can embrace and use, process indicators and impact indicators. But my advice will be, I don't have the perfect solution, but my advice will be that any monitoring and evaluation should be simple, should be down to earth, not 200 indicators and things like that. I think monitoring and evaluation is key, but some examples, reduction or declining diseases, that's a major impact indicator of then at the long run. When a country eliminates the disease, this is a success story. But also in health campaigns, how many people did you deworm? How many people were immunized? How many people were administered by, these are, because there are short-term and long-term indicators that we can use, and we want success showing at the short term and what means at the long term. So I think the concept of being simple and taking few indicators for a simple monitoring and evaluation plan, but I think success can be perfectly defined, and we should look into that.
Well, thank you very much. I'm very grateful for your remarks. That was excellent. Thank you, Marcos. Let me turn now to our next panelist, Dr. Christopher Gregory at Unicef. Now, Chris, if you turn on your camera, as you know, a major focus of this coalition has been the idea of a transition in some settings and circumstances from campaigns to primary healthcare as the means of delivering certain health services, such as immunization. From your point of view and that of Unicef, how can we as a coalition support countries in facilitating this transition where it makes sense? And specifically, what should the Health Campaign Effectiveness Coalition seek to accomplish in the next 12 months or so to be most helpful in this regard?
Thank you, Patrick. And I'd like to build on a little bit of what Dr. Espinal mentioned in his previous talk. Primary healthcare and the opportunity it provides to meet the full range of health needs of children and their families is incredibly important to UNICEF, particularly as it relates to the focus on health equity and child survival and development. But it's also really, as Dr. Espinal said, about putting countries first. So it's important that we see campaigns and primary healthcare not as a binary either-or situation, but rather as a continuum as health systems evolve, and that we realize that countries and parts of countries are in very different places along that continuum. This was certainly true before COVID, but is even more true nowadays with COVID. Even in the most developed healthcare systems in the world, the COVID vaccination rollout wasn't able to be done solely using the routine system for delivering services. We saw mass vaccination sites and drives take place in areas where almost all of health services are otherwise delivered through a primary healthcare approach. And the ideal that we'd all like to see, obviously, is to have well-developed, resilient PHE systems capable of delivering a broad-based package of essential services in a uniform, efficient, and equitable manner. But we know that in reality, there are many countries where we are far away from this ideal, particularly now with the pandemic, and where parts of the population do not have access to healthcare or nutrition services of any kind. And realistically, for some places, this is going to be the case for decades or possibly forever. So how can countries know when and how to transition away from primarily a campaign-based approach to a primarily PHC-based approach? And you note that I emphasize the word primarily because even in places that do have strong PHC systems and even universal health coverage, they still utilize campaigns as and when needed. So one concrete thing that I think the coalition can do in the next year that would be really helpful is to provide normative guidance and tools on how to make this transition, how to gauge readiness to begin this process, provide milestones and benchmarks to measure progress in this transition, and importantly, create guardrails so that the transition doesn't actually lead to worse outcomes potentially for the ultimate intended beneficiaries in the community. Because we know that there will be trade-offs involved. Intensive, time-limited, focused efforts such as campaigns do reach children and families that are not being reached through ongoing service delivery in the healthcare facility in many parts of the world for multiple reasons. While there are certainly well-documented limitations of the campaign approach in terms of financial sustainability, and in some cases, even when very narrowly focused in community acceptance, in general, they tend to provide more equitable coverage and reach otherwise underserved individuals and communities. Maybe not as well as we would like in many cases, but that's still a major value of campaigns currently. So we run the potential risk of exacerbating health inequities during the transition if we don't do it carefully. And what I would hate to see is part of the population ends up receiving increasing services through PHC, while others receive less or nothing at all without the safety net of campaigns being in place. And this is taking place in a context where Unicef and many of the other partners in the coalition are trying to do two really audacious things at the same time. Reach more children than ever before with immunization and essential health and nutrition services, especially in fragile settings. And at the same time, integrating COVID-19 immunization, this massive framework that's primarily targeted today to different population than our normal essential immunization in childhood, and with some different strategies into the broader immunization program. Either one would be a sort of a gigantic effort by themselves, but together they really represent an unprecedented challenge for health systems worldwide. And that's why the guardrails that I mentioned before during this transition are important, and why I think the coalition, through building on the decision support tool and other work already underway, could help build a package of guidance and practical approaches to assist countries during the transition process, particularly in continuously monitoring the process. But as Dr. Espinal said, this should really be, sort of not overly complicated monitoring that's really country focused. Something that I would, consider to be, akin to rapid campaign monitoring in a campaign. This would be rapid transition monitoring to provide timely feedback that during this transition, sort of the most vulnerable children not missing out on the services they deserve, and to ensure that the hard-fought gains and improved health outcomes and child survival of the last several decades are not being lost along the way. Thank you.
Thank you very much, Kris. That was excellent. I really resonated with several things you said there. One, of course, that it's not a question of campaigns being bad and primary healthcare being good. It's a question of finding the right balance that does the most effective job to reach people. I love your idea of the concrete ideas for normative guidance and your concept of guardrails, very important. Throughout the conference, I've heard several people reference concerns that as we make this change, that we don't, as you say, not only lose the progress that we've made, but inadvertently do damage, and as you stressed, perhaps even accentuate inequities in our efforts. And of course, the scale of the challenge, as you laid it out, is just enormous. So, so I thank you for going through that. Do you know, and as you think about this, I'm imagining different countries will be ready for transition at different times. So, so the first thing you mentioned was sort of an assessment tool. I imagine some of that assessment tool might be readiness assessment. Are they ready for that transition, or what would readiness indicators be? Is that how you were thinking about it?
Yeah, exactly. And I mean, I think, sort of having sort of a set of defined, framework that's in place already, that indicates, sort of, do you have the necessary ingredients, in your system, that this is the time to, sort of start that transition. And if not, then, sort of the focus should really be on getting to that point, sort of where you are prepared to do it, because this is the eventual goal for all countries, and I think that we can all, agree and share in that vision. But, it'd be very helpful to, have something that's a little bit more specific, and so the countries can really, sort of see, for campaigns, we have readiness assessments of where countries are before that, at certain intervals before they have a campaign. It seems to me that, we should have something, sort of that's analogous to that, for this transition as well, and say, okay, do you have the health facilities where, sort of they need to be, or is there sort of a plan that's got, costing with it, and then that funds are available to sort of really build out that primary healthcare system before you sort of move, sort of away from the campaign. So we don't get into the situation where we realize that, we have neither the benefits of a primary healthcare system nor the reach of a campaign.
Right.
And that, sort of those children in those communities that we're most interested in reaching are the ones that are falling between those gaps.
Excellent. Thank you very much. That was terrific. Let me now turn to our next panelist, Chris Wolfe, if you'll make sure your camera is on. Let me turn to Mr. Chris Wolfe at the Bill and Melinda Gates Foundation. Chris, the way campaigns are run, or I should say the way campaigns are financed inevitably drives the way campaigns are run. Can you share your thoughts about potential changes in campaign financing that could promote a more coordinated approach to planning across health campaigns, as well as financing changes that have the potential to strengthen country capacity to plan and implement health campaigns in an optimal balance with their primary healthcare services?
Let me just come off mute here. So thank you for the question, and thank you for the opportunity to speak to the coalition and share some of these ideas. These are both, I think, pretty gnarly, complicated, tangled questions. I know from interaction with the coalition that there is intent and will and interest to change how financing is done, to find more opportunities for integration. Yet the way business is currently done disincentivize that, and it's built-in disincentives. These are things that need to be untangled. And I thought, thinking about that reminded me of a story from my childhood. If you don't mind, I'll start with sharing it. When I was 10, my grandfather offered to take me deep sea fishing. And I was super excited about that and thought I could catch really big fish because they're fish in the ocean. And we motored out in a charter boat with about a dozen other people a few miles out to sea. Everybody dropped their lines in, and not too long later, my reel really started spinning. I had a fish on the end, and I started reeling it in, and it got really hard. And all around me, everyone else, their reel started spinning as well. Mine got more and more difficult and more difficult. And I thought, this must be a massive fish that I have on the end of the line here. And then the crew of the boat started yelling and shouting, and they all came around with knives and they cut all the lines. And as it turned out, what had happened is School of Fish had taken the bait of all the lines, tangled all the lines, and my big fish was actually somebody on the other side of the boat, and we were pulling against each other. And sometimes health campaigns in countries feel like that. We all have these health outcomes we want to achieve, and sometimes we're pulling against each other, even though that wasn't the intent. And when I think about what could be done to untangle this situation, three things came to mind. One is, let's start with the funders and how we harmonize across the funders. And I know from Marcos, Dr. Espinal, and Christopher were mentioning this country-led approach, which is absolutely important. And I think it's also important how we show up and how we interact with countries. And for the funders, the major funders of campaigns, the NTDs, the measles, the bed nets, yellow fever, polio, we all have different approaches in what gets funded, what are the application details, how the funds flow to countries, what are the amounts that get paid for various components, whether it's distribution or logistics or the frontline workers. And there can be differences there, but I think there probably are a lot of commonalities as well. And I wonder if in 2022, the coalition can commit to convening the major financiers of health campaigns, where we can, at a minimum, look across all of our processes, the modalities, and see where are there opportunities to harmonize the amounts that we're paying, what we're paying for, application processes, where can we use common data that was submitted for some other campaign that doesn't need to get submitted again. Any opportunity where we can streamline our efforts, identify areas for integration, looking at possible or potential plans for campaigns coming up, and reduce the complexity for countries overall. The second area that comes to mind is, can we work together to solve an area of common interest? All health campaigns, as I mentioned, do have some areas in common, even if our strategies and tactics may differ. One area that comes to mind for me is funding flow, particularly to frontline workers. And this funding disbursement in many campaigns can be quite a challenge. And one solution to that challenge is mobile payments. This is possible in nearly all of the countries that I think we're passionate about and want to support. And it offers a way to have reliability in payment for work that's been done, that's timely, and some transparency to the funding that flows out to the frontline workers. And there's a track record through some specific campaigns in some countries for doing this. And I wonder if the coalition work together with the countries that would be interested in this to create embedded capacity for where government systems can use mobile money to funnel funding that's coming from the major financiers of campaigns, to funnel that money through a mobile channel out to front workers in a way that would be different than it's done now. And this is a platform that any group that's financing a campaign or running a campaign could actually get behind and use. So it's a common need, and it seems like working together to address an area of common interest would be a good use of the coalition's efforts. And the third, which maybe is a little more of an experimental idea, but I have wondered, is there a role or a need to work with the government to see about establishing a campaign coordination hub within the government? This would be, health campaigns are often viewed as extraneous activities to the health system, and we've heard themes of that running throughout. They can also be viewed as a tactic of the health system for a particular set of circumstances and at a particular time. And can you embed a coordination hub within Ministry of Health, whose job is to look across the various verticals, and we know in many countries, just like within ourselves, they are organized in quite vertical ways. Could there be a hub at the ministerial level that is tasked with at least visualizing campaign plans across all these verticals, looking for opportunities for integration, looking for opportunities for sharing, and getting this sort of capacity set up at the country level?
Boy, that's terrific. Thank you very much, Kris. Those are all really great ideas. I'm just very excited about the last one, because I think the idea of experimentation is something that this coalition can do, particularly if there are certain countries who want to work with us. And we've talked amongst ourselves about if we want to put the countries first, they have to be in the driver's seat about when campaigns come and where they go and how they go. And I don't know how a country could do that if they didn't have some kind of government campaign coordination hub. So the idea of seeing if there's a country that wants to try to develop that and defining exactly what that is very exciting. There's a bunch of other things I'd like to say, but just to make sure we respect our other panelists' time, I'm going to move on, and maybe in the Q&A we can come back to some of these things. But thank you very much, Kris. That was just terrific. Let me turn now to our next panelist, which is another member of our leadership team, Ms. Anarata Gupta of GAVI, the Vaccine Alliance. As it happens, Anarata is unable to be with us live today because of a previous commitment, but she kindly offered to be interviewed and recorded in advance, and thereby contribute to this important panel discussion. And I'd like to go now to that recorded interview if our friends at MIT can cue up that video. Hello, Anarata, and welcome. And thank you for taking the time to share your thoughts today with the Health Campaign Effectiveness Coalition. As you know, in this panel, members of the coalition leadership team are being asked to share their insights about ways to strengthen collaboration among campaigns and with country health systems, as well as opportunities to improve health impacts by changing the ways in which campaigns are financed. And we're also asking leadership team members to share with us their priorities for specific actions that the coalition should take during the coming year toward achieving the coalition's goals. So with that, and given the current context from your perspective, what programmatic and funding changes are needed to promote more strategic, integrated, and ultimately more effective approaches to campaigns? And what can the coalition do to bring about those changes?
So thank you, Patrick, for that wonderful question. I think it's a very, very timely question that we should all be reflecting on, because I genuinely feel that COVID-19 is forcing us to think differently. Financial and capacity constraints caused by the pandemic mean that countries really are hugely stretched, and more efficient and integrated approaches show that based on current estimates for 2021, where we are hoping countries would be able to achieve 20% coverage of COVID-19 vaccination, it would really mean that GAVI countries would have to add more than 3 times as many vaccination touch points on top of routine immunization. So typically in GAVI countries, we see 40 million routine immunization touch points every month, and COVID-19 would add more than 120 million touch points to that. So really taking the total to more than 160 million touch points every month. And this could further increase to 8 times in 2022 to reach 60% coverage of COVID-19 vaccination. So this change context means that a mechanical reinforcement of business as usual is simply not an option anymore. We must update our programmatic guidance to encourage approaches that better respond to the current epidemiological context, country capacities, and the wider needs of the population, particularly of vulnerable groups who are consistently missing out on basic vaccines and other essential health services. And I really feel that in light of this, we need to ensure that campaigns are used strategically as a part of a very holistic disease control, focus being on sustainably improving routine immunization. Countries can ill afford to undertake multiple nationwide single antigen campaigns that do not meet the required coverage levels and do not prioritize zero-dose children. And I also feel that campaigns are supplemental approaches. And so they need to be just that, supplemental to routine immunization, and should not become the primary vehicle to provide single antigen vaccination to all children. It is therefore critical that campaigns are tailored and targeted to reach zero-dose children and missed communities who actually suffer from immunity gaps and bring them into the routine immunization fold. We also know that these children, the zero-dose children, often suffer from multiple deprivations, and therefore I think we have an opportunity to maximize each contact with them and provide them with regular reliable essential health services, including immunization. Because we also know that though 1 in 8 children is 0 dose, they account for nearly 50% of vaccine preventable mortality, and therefore suffer from disproportionate burden of deaths and morbidity. I also think that we need to encourage and incentivize countries to implement other more routinized community-based delivery strategies. We should include outreach and mobile services plus PD-like supplemental efforts. And we also have, as you know, increasing evidence that the most vulnerable populations may find it hard to approach fixed health facilities. So it is important that we take services to these communities routinely, and we should also not overlook the importance of on-time vaccination. And this is something that I really very passionately feel about. And children should not be made to wait till a campaign happens. And on-time vaccination can happen only when routine immunization is up and running. And then finally, rethinking financing and financial incentives, in my view, is going to be very critical. Financing should increasingly focus on supporting countries to map children and populations that are chronically missed by both routine immunization and campaigns. And we should make sure that, that countries use the operational costs that are provided by institutions like GAVI very thoughtfully in order to tailor and really have targeted approaches to reaching these populations. So in terms of key actions for the HCE coalition this year, I would really encourage focus on ensuring that we very clearly message campaigns as a supplemental part of a holistic disease control strategy, as I said. And with the key focus brought on improving the breadth of delivery strategies across routine immunization to improve coverage. Secondly, I feel that the coalition can do a great job in advocating for tailored and targeted approaches to sustainably reach 0-dose children in missed communities and progressively reduce dependence on campaigns. I think we have to get to a situation where we understand that campaigns are not there forever, to stay forever, right? And with steady improvements in routine immunization, the need to run supplemental campaigns actually should go down. And then support for multi-antigen and multi-sectoral approaches is another thing that I would advocate to maximize the health contact that we establish through campaigns, acknowledging that this would require high quality planning and dedicated resources. And from GAVI's side, and it would be immensely helpful if the coalition could weigh in to actually support us on this, that we would want countries to utilize the operational costs that we provide to implement campaigns to actually adopt highly innovative, routinized delivery strategies rather than just relying on business as usual approaches, because we have seen that only 20% of the campaigns that were implemented during the last 5 years with GAVI support reached 95% coverage. And in many cases, campaign coverage stayed below MCV1 routine coverage, and in some cases lower than MCV2 coverage. And that's not an ideal situation.
Well, thank you very much. Wow, you shared a lot of great ideas there, including some very specific things we might do in the coming year, and I appreciate that. We just have about a minute left. Just very briefly, if we were successful as a coalition to do some of those things you mentioned just this year, if we were able to move the ball down the field, if you will, in 12 months, we did some of that advocacy and helped develop some of that policy. What would success look like in 12 months? What would we have seen? Is it a convening of the key people? Is it actual changes in funding strategies? What should we try to accomplish this year?
So I guess if the coalition could actually bring all key stakeholders behind this new direction of travel, and at GAVI, we have already adapted our guidance. And we saw then when disruptions took place last year after the pandemic hit, we actually were very flexible in supporting countries in restoring immunization. And we saw immunization bouncing back. And we saw very encouraging examples of countries actually catching up on missed children, not just with measles vaccine, but with the whole range of antigens. And that actually proved a very effective strategy, because in a lot of countries, at the end of 2020, we saw immunization coverage even better than pre-pandemic levels. And I think that's something that the coalition could actually advocate for and lend its voice and support to GAVI to continue to support countries in this new manner.
Excellent. Well, thank you very much again for taking the time to record this and being part of this wonderful panel. We really appreciate it, and I wish you the very best.
Thank you.
Great. Well, I'm very grateful that Anarata was able to join us in this way. I'm only sorry that she's not here to take your questions from the other members of the coalition, but you heard her touch on a number of themes that both our panelists and the coalition have touched on since we started. Let me turn now to our closing panelist and the chair of our coalition leadership team, Dr. Ahmed Joffrey of WHO. Hamid, having heard just now from some of your fellow leadership team members, I'd like to ask you to reflect a little bit on the thoughts and ideas they shared with us, and also to share your own ideas for what this important coalition can do to improve the impact of health campaigns and strengthen country health systems.
Great, thanks, Patrick. And first of all, I really want to congratulate the coalition and the Secretariat for putting together this wonderful panel. And I've really enjoyed comments by all the panel members, very, very good comments. And it's really quite incredible to me as I reflected on the topic, that how much there is sort of consensus and congruence around some key thematic areas. So what I've done, Patrick, is to really try to boil it down in very concrete steps that the coalition might take in three topical areas that you've discussed today: the facilitating collaboration, the financing, and then balancing the routinization, as Anurada mentioned, of services and reducing reliance on campaigns. So maybe in all of these three topics, I'm just going to run down a list of summary ideas, for the coalition. I think in terms of coalition to facilitate cross program collaboration, I think we should really first and foremost, as Marco said, put countries first and select a certain number of countries and focus on them, and assess the status of collaboration and document lessons learned, and then obviously take some concrete steps to facilitate collaboration. And in many countries, sometimes different programs have already planned out campaigns. So I think it would be good to start by documenting what are the planned campaigns over the next 2 years, and then work with the countries to help create a platform, or what Kris Wolfe called, the campaign hub, where the programs can actually come together well in time to assess the opportunities and synergies in collaboration, and also clearly identify what are the obstacles to their collaboration, and identify both shared risks as well as risks that may be unique to particular programs in a collaborative campaign, and then together devise mitigation strategies. And all of this can only be done if the planning starts for collaboration early enough. And then I think what it does is that it positions programs to speak with one voice to all stakeholders, whether it's the donors or it's the government leadership. Then collaboration is in a mature state. I think the other thing the coalition could consider is to really create some kind of a dedicated group that looks at cross-program collaboration during outbreaks and humanitarian emergencies, when planning for coordination, information management, and financing really all need to move at a very different pace. Often many very important opportunities for collaboration are lost during outbreaks or emergencies because of such, a lack of such a platform that would bring programs, together in emergencies. And then finally, in this aspect, I would say document both good and bad practices and lost opportunities in the designated group of countries over the next 2-year period. On the second question of financing, I would say that it would maybe the coalition could pull together a document that describes the financing procedures, requirements, and timelines of major program donors and partnerships such as the Global Fund, GAVI, GPEI, development banks, and others. So this information is actually available for all in one place. And Kris, Wolfe again talked about convening various donors to sort of understand their mechanisms for financing. And then also then develop principles and guidelines for cost sharing of combined campaigns. I think other panelists mentioned about efficiencies, cost efficiencies, and such. And then, shared financing and innovations also bring opportunities for other programs in a collaborative relationship. Health workers learn new skills, or technology brings new innovations that benefits the other programs, and that fosters motivation and technological efficiencies in the long term. And then again, I think coming back to emergencies and outbreaks, I think it is important to encourage donors and funding partners to develop mechanisms for rapid financing in outbreak and emergency situations so that major opportunities are not lost because of slow financing processes. I'll just quickly summarize my thoughts, and I think a number of colleagues and panelists have mentioned about the idea of how to move forward with sort of services being provided more through routine primary healthcare services. So it will be important to develop the assessment tools and criteria of transition of services from campaign mode to routine delivery, both at national and subnational levels, because provinces and states are often at different levels of development in countries. Assess financial and other incentives or disincentives. I think Kris mentioned that hamper transition. But also develop a risk assessment tool to flag health systems that are not ready to transition. And Gregory mentioned that where premature transition would either adversely impact disease control or equity of service delivery. And then also, I think the coalition could clearly identify situations and programs where campaigns remain the most effective disease control modality, regardless of the strength of health delivery systems, and that often we see during disease outbreaks or during mass vaccine or drug administration, where you get greater epidemiological impact when you do it in a campaign mode. So, Patrick, those are some of the concrete ideas, and I think many of them you see echo what your panelists have said. And let me stop here and see if you have any questions for me.
I think that was just terrific. I really appreciate you bringing up the, well, several things, but one of the things you pointed to was the need for us to behave more quickly, not only with financing, but certainly including financing when we're facing an emergency, a public health emergency of any sort, whether it's an outbreak investigation or panic or a massive hurricane or tsunami or whatever it might be, that we really can't do business as usual. So exploring mechanisms to foster that kind of collaboration. Obviously, you have to do that kind of preparation in advance. I could go on, but to maximize our time with questions and answers, I'd like to turn to that now. So if our panelists could all turn on your cameras and maybe go into gallery view on your monitor so that you can see other people here. There's a number of great questions in there. I'm going to start actually with the last one because it touches on what several of the panelists mentioned, but I'm going to read parts of it in full. It's there in your Q&A if you want to pull it up. It's at the very end of the thread. But thanks to the panelists, but it says, at the end of the day, there's no point in preaching integration if at the global level, it's not being encouraged by the way we fund things. And an example is given with the immunization space that GAVI funds. What can they do to ensure campaigns such as yellow fever, meningitis, and measles that they fund are integrated in their applications? Similarly, has GAVI and Global Fund started the discussion on how to integrate their activities, even if it is just some of the campaign components? I'm inferring that maybe that hasn't happened from Kris's suggestions and Hamid, your echo of those suggestions, that maybe it would be timely for us to convene this group of major funders, the Global Fund, GAVI, Gates Foundation, others, that have a stake in this to start doing at a minimum some of the very practical things, Hamid, you pointed to the end, such as just getting a calendar of funding and knowing what the timing is so we can plan early, but also look at some of the larger potential changes that really would foster collaboration and foster and support all the way down to the end. So we're actually supporting delivery of services in a way that really makes sense for the countries. Does anybody want to, any of the panelists want to speak to that general question? Has this already started, or is this just something we really need to get going as soon as we can?
Patrick, it looks like Kris wants to, Kris Saarlas wants to respond to this question live.
Sorry, I was just clicking the button that says answer live. It's not for me, it's for you.
Okay, well, there's another Kris we can go to. Kris Wolfe had his hand up there, I believe, a moment ago.
Yeah, I think there are some discussions that I'm aware of that have started between GAVI and Global Fund, but it's not in a structured way, going through all of the elements that have been referred to in this conversation so far. And that was, I think it's relatively straightforward to do and is something that is achievable for the coalition. We have Anarata, we have the Global Fund within the coalition, and some willingness. And the place to start is, let's at least baseline what all these processes are and see where there are connections or where there are ways that we can coordinate in ways that that we're not currently.
Ahmed.
Yeah, no, I think I would say that if we take a systematic approach to more advanced planning and really facilitate collaboration early on, I think the financial discussions will naturally fall into place across different funders. And I'm sure that if there is structure given to this and the government provides leadership and the partners sort of catalyze that process, I think it's the interest of funders to actually look at cost efficiencies there.
Right. Let me now go to another question. It's the very top of the thread, question from Dr. Jim Lavery. He reflects on the story that Dr. Espinal's story, the African Minister of Health, highlighting how accountability in many ways for global health campaigns has been upward accountability, which is to say that the people who are funding it, the people who do the work must be accountable to the funders. How do we turn that around a little bit and have downward compatibility? So we're actually putting countries first and communities first. So accountability actually is driven by how it is perceived, how it works, how effective it is, as perceived by the people who deliver the services and by the communities that we serve. Marcos?
Yeah, I saw a question. That's a great question, and let me just because it also related to the previous question. I mean, donors are great. They're doing a great job providing the funding, and they are becoming also more technical and technical. Let's not make it's not the issue of accountability is not the fact that we know donors' money is taxpayer money from those countries, the US, UK, G7, and all these things. The key issue and the key here is, and it's related to the previous one, how can we plan better and be more inclusive? So when the minister in Africa was referring to signing questionnaire, he was saying, on Monday I have a donor, on Tuesday I have another one, and on Wednesday I have another one, or NGO. One NGO, Friday, the next one. There are famous NGOs out there, we know, that they go and do things for 1 year or 2 years, and then they leave. And they don't ensure accountability, or they don't ensure, sustainability of the good things that needs to be sustained. So for me, the key issue is that more dialogue, donors talking to themselves and say, well, let's go together to this country because we can maximize our money and avoid duplication. And I think the coalition could do it, as you said, Patrick, bringing together all these donors around the table. I think it's important the donor needs to monitor and evaluate. And no doubt about that because it's a taxpayer money. But if sometimes they don't talk to each other and come with different territorialities, I think the other thing is flexibility. Health campaigns is making sure we take advantage of the already platforms that are there, and we don't create a new one that is going to be a burden. And if the donors, the governments, we are all flexible and dialogue with more advanced time, then I think we can solve all this issue and rushing things that your report is due tomorrow, your report is due. But there is no doubt the funding that donors provide is really key, mainly for low-income countries, and they need it. But I must say this in defense of the countries also, most of the money that goes for endemic diseases and for pandemic diseases comes from the countries. Mm. Donors provide a percentage of money, but most of the money, the highest investment, it has been showing TB, malaria, HIV, NTDs, comes from the countries. So we need to be flexible, all of us, and the agencies to be, and the coalition to be a broker of finding consensus. That's the way I see it. And we can exercise both upward and downward accountability.
Excellent. Thank you. Gregory.
Thanks. And so I echo Dr. Espinal's comments about this being a fantastic question. And I think it really gets to this issue of, sort of human-centered design, which has been discussed, in the last few years, particularly, around immunization programs, but, sort of more broadly around, sort of campaigns and health delivery in general. And, we talk about an issue of vaccine refusal, like it's a problem with the individual who's receiving these services, that they're not, sort of understanding sort of the situation and the benefit. But sometimes it's also a problem of us listening to what communities are trying to tell us, sort of, and the message that, we sort of not always able to hear from the communities when they're talking about sort of what their needs are, what their concerns are, and it's not necessarily always about, sort of them not wanting this particular vaccine, but it's them talking about sort of, the program is not being designed, from the point of view from the community. We're right. Being very sort of directive as to sort of this is what you need, as opposed to listening to communities as to what they really need and what they're really missing out on.
Excellent, thank you. And that focus of the community, let me go to another question. And David Gittleman, if you're on, I'd encourage you to actually speak to this if you want to unmute your microphone. I don't know if that's possible from MYT's point of view, but I'll read your question and then you may want to speak to it a little bit more specifically. But David said that he really appreciated Dr. Gregory's comments about a readiness assessment of the public health, the primary healthcare system prior to integration. And he'd be interested to learn more about how the current tool that's been developed by the Health Campaign Effectiveness Coalition and its working groups for campaign integration. How should it be modified? How should it be expanded or improved to better meet that need? And so, David, are you able to come online and maybe even describe what the tool currently does and any thoughts you might have about how it might be improved given what you've heard?
Yes, so I've just promoted him. Hopefully, David, you can have a go at speaking and hopefully that should work. Just let me know.
Okay, hi, can you hear me?
Yes.
Okay, great, and thank you. So I think that part of the sessions yesterday actually looked in depth at the decision tool, and particularly some of the criteria that I put together at various levels, including, as Kris says, the community level, as to what each level needs to consider in deciding whether campaign integration is viable. My question is whether the toolkit, the decision toolkit as presented now, goes enough into depth about that for a country to be able to do a viable assessment, as you are discussing about that. So that's more perhaps for the HCE office to take a look at it to see whether we need to add more to it. To decide whether the methodology and what we're doing to help countries do this is enough to get to that assessment, or if there's something else that we need to add on to it, or some other form of tool or something that we need to do a more formal assessment beyond sort of the more general thing that the decision tool is suggesting. Thank you.
Any thoughts from our panelists on that? Well, I'll tell you what, David, why don't we dig into that some more? So I think it's an important question, and I've heard this reflected a few times, that we want to do the transition, but we don't want to break things while we're trying to fix things and make them better. So it sounds like it's an important tool, and we either need to make sure it's better used or that we actually test it and make sure that it's it's having the results that we hope for. I think I have time for one more question I want to turn to the panelists on, because I think it's an interesting question. We've been talking about engaging with countries and what the campaigns should do and how they should collaborate and share with each other. The question is, what are the panelists' thoughts on creating a platform that promotes more direct country-to-country learning about campaign integration? I'm just reading now. A lot of the ideas being proposed are global-level directed solutions where we are facilitating development of tools and learning avenues, but I'm not sure how much of that actually reaches country stakeholders and program managers. I thought that was an interesting question. Any reflections from our panelists?
Yeah, I could. In fact, I also like a question which has similar implications from Jim Lavery about whether finance ministries are engaged when donors are looking at financing. And I think these are really important questions about how do we, I'm again looking at this from the coalition perspective practically, that I think the coalition has two very important audiences. One is the governments, the national authorities, and whatever steps we take, how do we always ensure that they are the ones who are empowered, whether it is the accountability mechanism or whether it is a coordination mechanism, that they are the empowered entity. And the other audience is your program donors and the programs themselves, so that what information can become easily, or processes where they can actually more easily collaborate. And that's why I think I feel strongly that for the coalition to move forward, they should select a range of countries that represent different types of health systems and disease burden and economies, and actually take these concrete steps that really truly put the countries at the center, empower them, but also provide the necessary tools for the programs and the funders to engage in a more systematic way. That would be my general response to both of these questions.
Thank you, Hamid. Any reflections or any final reflections from any of our panelists on this or previous thoughts you may have had before we close? Kris, Wolfe.
On the topic of kind of country peer learning networks, there are a few to look at as examples. There's a joint learning network. There's also, I think GAVI has one on transition countries. Sabin Boost is something that's specific to immunization. So there are a few examples that may be venues where some of this discussion could take place instead of creating a new one. The challenge with all of these, of course, is time and bandwidth of program managers in countries to participate in these. But from what I've seen, there is good and active participation in the ones that I've mentioned, and I'm sure there are others.
Great. Thank you. I'm going to bring the session to a close. And if we were together physically, as I hope we will be next year, I would be inviting everyone to applaud this terrific panel. It's been great. I really thank you for sharing your ideas and your energy with us today. And I also want to give many thanks indeed for your leadership of the coalition, which has just been sterling. So many thanks to you for all of that. Thanks to all the coalition members for your great questions. I'll turn now to Ms. Leah Wyatt, who will provide some closing remarks for our two-day conference. Leah.
Hi, thanks. Thank you, Patrick. This meeting convened individuals who influence health systems, primary health care, and health campaign programs across all the major health domains. Individuals in this coalition represent multi- and bilateral organizations, foundations, and charitable organizations, ministries of health and finance, implementing partners, and research institutions. All those came up in our discussion today. So the relationships we build within this coalition serve as the structure that transforms the use of campaigns that are planned and delivered in conjunction with ongoing and routine health services. The transformation is determined by a collective and interest in learning about and adopting practices that work for the communities we serve, realizing a future state where country health systems are stronger use campaigns strategically and in concert with primary healthcare services is possible. How is this possible? It's possible through a generous collaboration among all of us and a trust that we are and we remain committed to continue the important dialogue in this second annual coalition meeting. A transformative change is powered by your active and your active and continuous contribution. So let me explain. We need to plan concrete actions. We heard a lot of those today for the next year. Tomorrow, I invite you to participate in an action planning exercise that you can conduct from the comfort of your desk. It's an exercise. I promise you won't break a sweat. You will, however, feed into what success looks like for this coalition from your unique perspective. Between now and the time you receive a message from me in your inbox, think about how coordination and collaboration across programs influence your work. Give some thought to the interactions within the coalition that can influence advocacy, policy, and campaign funding. And secondly, work within the coalition is achieved through work groups. We heard Dr. Wolfe talk about those today, about the different modalities for learning and exchange and getting work done. The email you will receive tomorrow will request your input on how best individuals in the coalition can work together and lead the activities towards achieving concrete accomplishments in the next year. Please applaud. Find your applaud button on the meeting platform. And applaud the Campaign Integration Work Group, who is modeling collaborative action right now through the development of decision-making guidance. The guidance developed is based on promising practices and has been included as a key resource in GAVI vaccine funding guidelines. Between now and tomorrow, give some thought to how you would like to continue dialogue that not only enables learning that is emergent, but also informs the adaptation and development of promising practices across local contexts and translates policies into practice. And last, but certainly not least, this conversation does not end today. This meeting is the ignition for connecting and forging new relationships. This platform will be open for another couple days. Feel free to send a message to another attendee, join a casual roundtable discussion in a third networking session event following this session here. And check into the discussion section of this site to continue threads of conversation and share your thoughts. I want to thank Liban Aden Muhammad from the Wadani Relief Organization in Somalia for sharing their initial reactions there. We can follow their lead. In closing, recaps from this meeting can be found on the Health Campaign Effectiveness Coalition channels on LinkedIn and Twitter. I would like to acknowledge the numerous individuals who made this meeting possible. Please give yourselves a round of applause. Because of you, we can begin to see the promise of collaborative action. Debs, over to you.
Thank you, Leah, Kris and Patrick. And on behalf of the MIT events team, as always, it's been our pleasure to support you over the last 2 days. As Kris mentioned, please do take the time to complete the survey that you'll receive tomorrow. And just a big thank you once again to all of our speakers and everyone for joining us. So we will shortly close the meeting. Thank you very much.